Hi, my name is Gabe. I'm a University of Washington EM residency grad from 2021. I'm currently still at the first job I took out of residency. I'm a partner in a physician group that staffs a few hospitals for multi-care. Primarily, I work at multi-care Tacoma General, where I am also a assistant medical director. So I help out with some of the operations and flow and working to improve that department. I was also fortunate enough to come back as a part-time attending at Harborview as well. So I also have the awesome opportunity to kind of straddle both community medicine and my job at Tacoma General, in addition to working in an academic county hospital at Harborview. So I still get to work with residents, which has been awesome so far. How did the University of Washington help me get to where I am now? I think I'll start off by talking about clinically, I'm able to practice the type of emergency medicine I wanted to when I initially thought about going into medicine to begin with. I was very interested in working in a higher acuity emergency department with an inner city patient population, be involved with trauma, sacred medical patients, and things like that. University of Washington and Harborview provided an excellent, more or less an ideal playground to kind of learn and develop different clinical skill sets, procedural skill sets throughout my time as a resident. So there was a great, 4 years of time spent between practicing in different clinical environments. UW has a great setup where you're able to work primarily at a county hospital, level 1 trauma center at Harborview, and you also have exposure to very complex medical patients at the University of Washington, so very much more complicated oncologic disasters and cardiac complications and things of that sort. And then simultaneously also getting an excellent community exposure at Valley Medical Center. So between being able to work at all three of those locations as a resident, I felt very well prepared to work basically in any clinical setting that I wanted to, which is basically what I do now. I continue to work at 2 large inner city emergency departments for high acuity. I also work at a couple smaller hospitals that have much less resource environments, so I feel trained to both practice in a lower resourced facility that is sometimes single coverage, in addition to also being to work at that high acuity inner city hospital. So that has been great. The University of Washington also helped me to prepare to be a future leader in emergency medicine. I felt like it did a great job in doing so by offering nearly endless amounts of opportunity to get involved in things outside of the traditional clinical emergency medicine arena. There are mentors for basically every possible subset in emergency medicine that you could possibly think of, from critical care, EMS, ultrasound, public health. Particular things that I got interested were critical care. I worked in the COVID ICU during the pandemic. I got involved in helicopter EMS, working as a flight physician for a couple of years, and I was also heavily involved in ultrasound. And then I rounded off that experience as a resident by being a chief resident in my 4th year, and I thought that provided an excellent opportunity to work on developing administrative skills, like learning what happens behind the scenes and running an emergency department, how to provide support in terms of improving throughput, operations and workflows through the ED, how to interface with other physician departments and nursing staff and support staff, in addition to how to manage a group of other physicians that you work with on a day-to-day basis. So between all of those things together, I felt like it was able to prepare me to do basically anything I wanted leaving residency. And then so now as an assistant director in an ER, I'm able to help deploy what I learned to help out my department, as well as to deliver excellent clinical care. So I've been very satisfied with my training to that effect. What's special about the University of Washington Emergency Medicine program? To me, the most special part of the program is the patient population, due to the sheer number of complex, underserved medical patients that we see in our facilities, as well as the very large volume of trauma that comes through Harborview. It is very common that residents are placed in situations where traditional clinical algorithms will fail. You're going to see some wild things happen in the departments here. And when that happens, residents will have to think on their feet to find truly unique and sometimes even heroic solutions to the challenges that they face. And it's because of these unique challenges at our facilities that I truly continue to enjoy working at Harborview and our other facilities. I think it provides excellent training to sharpen skill sets, and it's been a great experience.